I set the clock in the battalion chief's office today as well. It was also in the service of an hour off.
Couldn't figure it out.
I had that problem at the school, but then I put in atomic clocks in all the rooms.
They-
So I didn't have to
they
worry about it.
And you knew you had your source.
Didn't hear him last time.
Ready to start? We'll go ahead and call the meeting to order. First item will be roll call.
Mr. Brown?
Here.
Mr. Buckley? Here by video, he's muted right now.
He was up there. What do you think it was him?
I'm here.
There it is. Mr. Fritz?
Present.
Mr. Curtis?
Here.
Mr. Meehan?
Here.
Mr. Van? Here. We have Aaron Dirk, Amy Blueberry, Rob Pennington, myself. Dr. Gus will not be joining us tonight.
Next item will be a motion to approve the agenda with one exception. The medical director won't be available tonight. He passed things on to Eric to share with us.
And Mr. Chairman,
Yeah.
are we still going forward with item 8? I don't believe either one of those we're prepared to go forward with. I think, I don't know if you were informed or not, but the REMAX office has become COVID infected.
We'll continue with that.
Right. And then I think the other item too has been pulled. So
I take a motion to approve the agenda.
So moved.
Do we have a second? Second. All in favor?
Aye.
No, approving the agenda while moving to closed session.
We'll still have the closing, the closed session.
We still are having it.
Yeah.
Okay.
Has everyone had a chance to look over the previous meeting's minutes? If there are no additions or corrections, they'll stand approved as presented. Is there any public comment?
Nope, nothing was posted.
Nothing was sent in. Officers report, CFO report.
Good evening, everyone. So I won't be able to see you while I'm doing this. I only got one screen. So if you're going to have to speak up and interrupt me if you need anything. So my report starts on page 3, and you should have another printout that I sent over that kind of mirrors this one, that shows you the budget as it was approved originally, the items that you guys have approved since then, and then what the budget amendment needs to be. So that's just what that page 3 is showing. You guys have that?
Yeah.
Okay.
What's the difference on it, Mr. Chairman?
One of them is the original budget, and then it shows the amended amount.
Okay, so for budget performance starts on page 4. Overall, of course, we're doing pretty well this year on revenue and expenses. We're at 75.29% on expenses. And then on page 5, I broke out the revenue to show you net of any CARES Act funds or stimulus funds where we were year to date at the end of September. We were right at 75.2%. Did somebody have a question?
No.
No.
Okay. All right. And then page 6 starts the detail of the budget. And as you can see there, the service fees are down just a little bit, but our sales taxes kind of made up that difference so far this year. And then as far as expenses being over budget, medical supplies is over slightly due to the COVID expenses. But overall, we are pretty well on budget. Does anybody have any questions on any of that?
Mr. Chairman.
Yes.
Mrs. Boomerang, under Medicaid managed care, 117. Can you talk to that, please?
What's your question?
The question is that it's showing $117,000 this year and wasn't budgeted, so what is it again?
So it's Medicaid. I just broke out the managed care portion. So there is just regular Medicaid, and then there's fee-for-service Medicaid that we get paid from, like United Healthcare, that's Medicaid, and a bunch of different companies that also do Medicaid, as well as just Missouri Medicaid. So that's breaking the different kinds of Medicaid out.
Thank you.
Mm-hmm. Any other questions? Page 10 is the statement of net position, September 30th, 20 versus September 30th, 2019. Anybody have any questions on any of that?
Mr. Chairman,
Yes.
on page 10, total other current liabilities, Mrs. Boomerang, $8,200. What would that be?
Payroll liabilities. So that's payroll taxes, that's any sort of deductions from employees' checks that haven't been paid, like dental insurance, vision insurance, elective benefits, all of those items.
Good, thank you.
Mm-hmm. Any other questions? Okay, page 11 is the statement of revenues, expenses, and changes in net position. Same periods, 2020 through September versus 2019 through September. You can see the large increase in revenue due to those CARES Act funds. And then our expenses are up slightly over last year, mostly due to the increase in payroll costs. Anybody have any questions on any of that? Okay, page 12 just shows our bank balances last Friday versus the meeting prior. And you can see there that, you know, we had a big jump and then it's kind of leveled off there for the last couple of months. Page 13's got the cash reserve analysis. Again, just like I said, it's leveled off. It's just 3 days different than it was last meeting. The next few pages are the check register. Did anybody have any questions on any of those transactions? Page 17, we got sales tax early due to the way that it fell this month, and we got that on Friday. And again, that's up slightly over last year for the same time period. And overall for the year, we're at 4.6% increase over last year. Pages 18 through 20 is just the credit card statement for last month. Did anybody have any questions on any of those transactions? Okay, page 21 through 24, maybe? Nope, 25 is the bills and the details. We've gotten the ventilators. I think I heard Eric tell you guys that there was one there. We've also gotten the UV lights in. So there is a bill on here for that. That's the EA Medical. I think that's all the additional items other than regular monthly bills. Anybody have any questions on any of that? Okay, if not, that is the end of that portion of my report.
Jamie,
Yes, sir.
if you would, would you roll through, if you're not gonna do it later, the 3 line items that we'll be adjusting in the budget? And can we show folks the original budget amount, and the adjustments, and then the total amount? Can we go through that so nobody's left in the dark on that maneuver?
Yeah, do you want to do that now or when you guys do the budget amendment?
It's however the chairman wished to do it.
We'll touch base on that when we do the amendment.
Okay.
Clear. Are there any other questions? Now that take a motion to approve payment of outstanding bills.
So
Do we have a second?
Second.
All in favor, say aye.
Aye.
All opposed, same sign. Chief's report.
All right. I'm doing this from my iPad tonight and it's kind of askew, so forgive me if I look confused as I stare at this thing with my bifocals. I'm happy, very happy to report we're getting some work done on the generator. Those lines and valves were placed in today. By Meyer Plumbing came in and did all that throughout the day. I believe they got done. I didn't get a chance this afternoon to go out and check on them, but actually forward progress finally. So at this point, I think all we're waiting on, and Ryan, if I get any of this wrong, jump in here, but they had to change all the valves to each of the HVAC units over there. And then Liberty will come in and change the main regulator at the main, as well as, I believe, test the whole line and set it up whenever they can get out here. So really, they're the last missing piece of the installation. Once that's done, the generator company will come in and actually set it up to function, do all of its automatic tests, and it's pretty well a set it and forget it item. When they do that, we're not going to get complicated, any kind of control panels that unnecessarily complicate the system. Power goes out, generator kicks on. So at this point, we're no longer waiting on any of the plumbing stuff, which I honestly think was the longest of this whole ordeal, 9 months. So I'm looking for this to be done in the next couple of months at tops. That's giving it probably too much time, but yeah, we'll be waiting on Liberty and then the generator company themselves to do the final hookup, fire up the thing, make sure everything's good. So, sure.
And I might have asked this question before. A warranty on the
Starts when it's done.
when actually they come out and they crank it up and go.
Yes, sir.
That's great.
Yeah. So
Wouldn't be a big deal if it was a couple of weeks, but being 9 months.
Yeah.
that's gonna be a significant effect.
agreed.
Yeah, thank you.
Yeah. Education, we're doing a lot of education right now. Monday, we're actually doing in-house education. It's also being recorded virtually as well as attended virtually. So we've got some staff out sick. We've also got people who will be unable to attend just for various reasons, which happens, no matter what training. So we'll be doing all of that Monday. I look forward to that, getting those in. And this is not a one-time thing with those events. This is, as you can imagine, an ongoing, pretty well constant. We'll set one of them out in the day room. So when crews go on, they'll be setting them up, becoming more and more familiar with them as we go. So this will be a continual process, but primarily we're doing the Zoll vet training on Monday. That includes Zoll reps and some videos and actual hands-on exercises. And as I said, they're set up, one of them set up on the mannequin in the other room. So please stick your head in there and check it out. And if you want to press some buttons on it, that's fine too. So the MU Mobile Sim Lab is still scheduled for November 17th. And we also have some other in-house training on the 16th as well. So lots of training sessions. Despite COVID's best efforts, we're doing a real good job getting around, working around those challenges right now. Justin's doing a lot of juggling. We're all doing a lot of juggling because of that. So operations and supplies, the Zoll vents are being set up. We're not having to do much programming on them because they are really set up kind of how we need them already. There's some presets on them, so we don't have to do a lot of work in order to set them up for individual patients. There's a case that came with it, but we're looking at some better mounting options because in the back of the ambulance, really everything needs to be secure. Everything becomes a projectile in an accident. So we're looking at maybe some wall mounting system or a more rugged case than what's on it right now. So we're just looking at options there. The medications, there's an extra S at the end of my sentence. I apologize. I didn't catch that before the meeting tonight, but we're looking into prolonging the life of some of our medications. What we've got right now, most of our medications have whatever's on the label, that's the shelf life. But about 3 of them right now are refrigerated meds. And what that means is we pull them out of the refrigerator and then they have a limited shelf life after that. Some of them are good for 30 days, some of them for 45 days. But after that, we write a date on them when we pull them from refrigeration. They stay in the units. At the end of that period, we have to throw them out. That's a big money drain. So we're looking at some options. It's really hard to find a decent cooler that keeps them at this narrow range of temperatures they have to be at. So, and that's been a problem in EMS for as long as I can remember. So we're looking at maybe doing it on a shorter schedule where we change out coolers every 12 hours. And I won't get into too many details, but suffice it to say, we're looking at just about every option available, and we haven't found one that works real great yet. But I think whatever we come up with will at least be able to prolong that date a little bit rather than none at all. So right now we keep them as long as we can until we have to throw them out. But some of those medications are kind of expensive, and they are critical medications. Unfortunately, it's nothing we could do without. So we're just looking at trying to save some money and make it a little easier also as far as keeping stock. As you guys probably remember, we've had some drug shortages throughout the last couple of years. One of those medications is the problem I'm talking about. So the longer we can keep them in, the better. So I'll keep you posted if we come out with some sort of epiphany, but right now it's looking pretty low tech. Ice packs in a cooler are probably our best bet. They make refrigerators for ambulances, but they're subpar. No matter who you get it from, they're just not really a great option. They're hard to regulate the temperature, the primary issue. PPE, we are, to put it, the short version is we're using more than we're getting in. There's no nice way to say that, but with our spikes and transports, we are dipping into some boxes that we're hoping to not have to dip into. We are in good shape. We did a lot of good stocking this year. I spoke with our EMA, our local EMA director, and she's helping us out with getting our hands on some of the state cash, which will be free, so no charge for that. And that's looking like it will be at least 2 out of the 3 items that we really, really need right now. Gloves and possibly some gowns. N95s continue to be elusive, but we're going to get some sort of them up there. So something's better than nothing. I'll be driving up there and getting those personally within the next week. So that'll be a nice little addition to our decreasing cash. I don't know what the reason is behind gloves. You think there's enough plastic and rubber in the world, but apparently I think it's just the demand outpacing the supply, quite frankly. EMS is pretty hard on gloves too, as we open up boxes and carry cases instead of just in a controlled environment. So we have to have a nice, thick, heavy, robust glove. Law enforcement uses those as well. So we're kind of competing, everybody in emergency services competing for the same products right now. So right now we're doing okay, but we are definitely looking at our different resources, trying to keep them local suppliers, if not the SEMA cash, American-made stuff as much as possible. Staffing and COVID, I wish I had some better news to give you guys on this, but it's just about each day for the last 7 days, we've had somebody either come positive with COVID or leave with COVID-like symptoms and likely have COVID. So we are seeing some dents in our staffing. We're not seeing any dents in our coverage. And I'll get to some of that discussion with what Dr. Gustafson and I spoke about. But again, I want to assure the board there's no operational staffing issues right now, other than having to call in some PRN staff and a little bit of overtime to cover these people's open shifts. About 20% of those that are out are PRN staff, so there's not a big loss, but our full-timers are being affected. This is an event. We are seeing some fallout from COVID at this point. I am happy to report everybody that's out is trending in the right direction, getting better. So we don't have anybody that's critically ill, thankfully. But all through healthcare in Sedalia, it's not just us, it's affecting and not just today, but regionally, we're having problems getting transfers out. Some of the regional hospitals are not accepting ICU patients at all anymore. So Bothwell's really being taxed on this. They're doing a superb job, but they've got, as of noon today, around 27 patients admitted to Bothwell. So that's an extraordinary amount of admits. So they're keeping a very close eye. As far as I can tell, doing a good job of mitigating it. But we're all kind of stretched. Vehicles, the ambulance air scrubbers are ordered from the factory, but do not have an ETA on them. That's similar to the station scrubbers that the board approved that are running and working great across the street. I gave you some information there on units 7, 3, and 10. 3 did have a deer strike. Unfortunately, we had another deer strike after this report that did some significant damage to one of the older ambulances. I won't say luckily, but luckily. It was one of the transits down in Windsor, Unit 9. It's got heavy front end damage. Hit a very ornery deer, and it's pretty rapid. I don't know. It's across the street. If anybody wants to see it, we're waiting. I don't have much information on it other than it could turn into insurance, and we're waiting for it to come out and actually look at the damage on it. So I'm at this point kind of hoping they total it. It's got 153,000 miles on it, and it's the entire front end was affected by this. Where normally we clip one of them things on the side and it takes a quarter panel out. This one it just hit flat on, wrapped the radiator, and all the front end was squished. So I can't tell by looking at it if there's any structural damage as far as engine mounts or anything like that. I'll definitely keep the board apprised when we find out a little more information on how that gets damaged. So in the meantime, though, we're okay on trucks. Unit 6 was sent down there to cover its bases. We've had some electrical issues. This is not unusual in the ambulances. They're, as you can imagine, they're very tech heavy. So there's always the possibility that we're going to have electrical problems. Unit 10 was having a little more than usual. So its entire system is being evaluated right now. Headlights problems, other security cabinets problems, but I anticipate it's generally a control board in that situation or bad ground. So hopefully we'll find out what that issue is. On the call volume report on the next page, which hopefully I can read this sideways. Yes. October is a record month for us. 724. It's the most calls we've ran all year. It's the most transports we ran all year in 1 month, leading us up to 724 there. You can see in the PCAD column up top. Our total transports out of those calls was 506. So also a record number for the year. Very busy month for us. Our year-to-date totals, you can see this year we're up 6,481 from 6,200 last year at the same time. So our normal trend is kind of back where it normally is at that overall 4% rate. Definitely took a dip earlier this year due to the pandemic. Windsor, we also had a very busy month in Windsor with 118 total calls. 73 of those were transfer ports compared to only 57 last month. So we are getting our fair share down there. 8 of those were out of Bothwell, 9 out of Golden Valley. And then the actual 911 calls was 56. So 911 calls up quite a bit down there as well too. 910 last year, we're at 975 this year. So we'll definitely be breaking our totals for both PCAD and Windsor once again, despite COVID's best efforts. So I put in another chart so you all can kind of see where we're at. The next page. This covers that back column as our total. This is through October, and it's April 17th because that's when we actually added that data set to our reporting software. So April 17th, anything before that, we don't really have much good data on, but you can see that familiar curve in the background where we got that initial peak, and now we've really scaled up on our positives. I found the middle column kind of interesting that it went down. I think it's just because for a while, we were getting a lot of people who were pending results, or they were worried they had a family member, or anything I'm saying with this is pure speculation and anecdotal, but those suspected cases have went down. However, our positive cases, as of today, puts us at the second worst rate in the state of Missouri. That's counting. So we're not mitigate that. And I'll just end that with advocating for mask use and social distancing and all the stuff everybody's heard. Those things really do make a difference. And I just closed my report. So if there's any questions, I'll try and do it from memory.
Mr. Chairman,
Yeah.
I have one question. On Unit 10, put that in perspective for us, where that falls in the fleet. Is that one of the newer ones?
Unit 10?
Yeah.
Electrical, yeah.
It all, gotcha.
Yeah.
Thank you.
Definitely. Very good. Yeah. And like I said, Unit 9 is one of the transits. If you haven't seen them, they're
That's that was skinny.
a lot of sheet metal, pretty easily done.
Yeah, it's a pretty bad. So thank you.
You're welcome. Got any questions?
Are there any other questions? Larry? Thank you.
You're welcome.
And you got a little something from Doc.
Oh, yes, yeah. As far as our medical director, I had a chance to speak with Dr. Gustafson for a meeting. I had some questions about protocols with him. He wanted the board to know that he's been looking very closely at our COVID cases and just our general operational cases as they go through the CPI process. He's not identified any real issues. He did say, despite, again, you'll hear me say this a lot, despite COVID's best efforts, the crews are doing well with their patient care. They're really good with the patient care because just about every other call, they're having to completely deck out with PPE, which is a real hindrance to doing good patient care, and it slows down the path of everything. But we haven't seen any big significant increases in the time from dispatch to actually making patient contact to time on scene and transport times have not been affected. Our quality of care, I don't believe, has been affected. The one thing that is being affected is our back in service time. We found ourselves just in the past week at 3 different instances being backed up 3 ambulances out at Station 2, which is where we're doing a full decon process. The reason we're doing that at Station 2 is because we have a shower that's right off the bay, and the trucks can pull right up to the bay, do the unit decon, including the UV lights that the board allowed us to purchase, which are working great. They only have to run for about 20 minutes before they've done their job. What's holding us up is the showering facility. So we spent a lot of today looking at some secondary sites, and I found some. I won't get into the details of where they're at right now with the board, but we are trying to mitigate this as best as possible. We're packed in pretty tightly across the street, so we're also looking at maybe secondary sites where the crews can separate themselves a little bit physically and not be so much on top of each other like we are at headquarters. I've spoken with several people around town, including Buffalo, and coming up with some pretty decent options that hopefully won't cost us anything. And we want to do our best to prevent any of this COVID spread between our staff. What you see in any healthcare organization, whether it's hospital, clinic, or anything, you see COVID cases as a reflection of the community. So when we've got a strikingly large increase in the community, it stands to reason you're going to see some people with us happen. So even though we do have a lot this week, I still contend that we've done an amazing job. I say the crews have done an amazing job avoiding the worst parts of this. So I definitely commend them on that. As far as Gus's discussion, we also talked about, so we have a protocol in place for pandemic response. And basically it's a last ditch effort. We're not there yet, but if you fail to plan, you plan better. So what this plan talks about is how we mitigate, what is our trigger for beginning the triage or doing anything that would affect operations. And the trigger for that is essentially we're overwhelmed, and not just us, but the entire healthcare system is overwhelmed. I think we're a long way from that. I hope we're a long way from that. But again, we're at the point where I think it's important we dig these plans out and kind of talk about them. So Dr. Gustafson agrees that if we reach we approach our minimum staffing levels, which is -1 truck at each outlying station and -1 truck at the central station. So if we fall the 5 trucks or below, we'll implement a little bit of a different response to where if we get a call to where the patient just absolutely doesn't need any kind of advanced level care or even basic level care, we will provide them with the means to contact their physician with any kind of information they might need. If it's a COVID concern, But in cases where somebody might not necessarily need to go to the hospital, we'll spend a little more time doing some preventative maintenance, if you will, also transporting them and overtaxing for services. Because every time we do this, like I said, it's about an hour just for us to get that truck back in service if we put a COVID patient back. So to be clear, anybody that needs to go to the hospital can go to the hospital, and we're not anywhere close to implementing that plan. But it is a contingency, and it's something I think that's important to discuss. But I think we have a good plan in place, we have a good protocol in place. Dr. Gus agrees with it, and I don't see any big changes needed in it right now. So hopefully we don't ever have to dust it off. Everything looks good, and like I say, we get paid to be paranoid. So we've got a good plan in place, and we're happy with where we're at. And Dr. Gus is good. So if I don't know, I can't answer any questions for him, but that's pretty much what it is.
You say it's about an hour turnaround once you have an ambulance that's has a patient or been contaminated COVID patients, about an hour to get that ambulance and crew back into.
Yes. Yeah. And a lot of that is because we go through a very intensive decontamination process, including that UV light, including going through the entire truck and wiping surfaces down if needed. The crew takes off all their PPE, they doff their PPE, they both take showers and change into fresh batch clothes. So everybody PCAD right now pretty much has to go back, so they can just cycle all of these clothes and put them in the wash. But like I said, with one bathroom and 3 trucks stacked on top of each other, it's a little log jammed, if you will. So we found a good way to mitigate that. It's not going to be any cost to the district or anything like that. So we're using some resources and gathering others. So going well. That's all I have.
Okay, thank you.
You're welcome.
Thank you. Committee reports, strategic planning committee.
I've got one response back for the survey. I don't know if anybody else has done yet. That's kind of where we stand on that. We're just waiting some results.
Unfinished business, annual health insurance renewal.
So I printed 2 copies of the renewal there. We've got basically 88% increase on our renewal.
It's on the trust mark.
There's another one.
Yeah, it's a trust mark.
There's a couple of them there.
Does anybody need one?
Nice.
It's on the trust mark.
There's just a couple of the trust markers.
Oh, the trust mark.
Yes, that's our health insurance.
Yeah, that's the health insurance. So yeah, it's an 87.8% rate increase. So we are getting some other options from IBG. They sent out the applications for employees to fill out today. We asked for those to be back on Friday so we can get some other options turned around, because that's just unaffordable. I mean, it's understandable when you see the claims this year. So far, we've paid $428,000 for our health insurance, and there's been $924,000 worth of claims. So our loss ratio is about 340% this year. So that's why the big increase, but that's what we're doing, is looking for some other options. I don't know if the board wants to do anything other than that, but that is what we've started with, is just IBG going out to market with health applications. Anybody have any questions or?
Are there any questions, or is there a desire to put it out for bid?
Mr. Chairman, yeah, in my opinion, at 87% increase, it needs to go up to bid. I mean, that's my thought. that is a huge increase.
And keep in mind with this broker, it'll go out to different folks. So do we want to go out with a different broker? I don't know how far you want to take it, but they will send out. How many things suspect did we get back last time, Jamie?
Well, they only brought us like the best 2 or 3. I filled out my application today, and I want to say there was probably 8, might have been 10 different companies they were going to send it to.
And then that broker will bring those different proposals to us. But I mean, our loss ratio is going to be something to be expressed to anyone now. They'll understand our loss ratio, so.
Well, I don't think we'd be doing the taxpayers any favor by not getting it out, and if it means going to another broker, I think it's true.
Well, Jamie, how long before we get these in from this broker?
So he said about 2 weeks turnaround from when the applications are completed. So if they all get completed by Friday, 2 weeks from then would be about Thanksgiving. So it'd probably be the first week in December before we have anything. So if you guys want to put it out to other brokers, we're going to have to do that now as well.
Yeah.
We're going to be out of time.
Say we should.
Yeah.
That's I know that's probably a standard thing around, but that's too big an increase for anybody.
Well, yeah,
Yeah, I asked what the standard was, what they were seeing kind of across the board. And he said generally about 10%. They've seen some 40 and 50%, but ours is by far the highest. And we're hoping that with those health applications that we'll find that some of the issues maybe were resolved this year. But I mean, we don't know that, but
So is it the desire of the board to put it out for bid?
Yep.
I'll make a motion to put it out for bid.
Second. All in favor, say aye. All opposed, same sign. Annual property and casualty insurance renewal.
so this one, we don't have anything in writing yet, just preliminary numbers. Going to be about a 15% increase. And they said across the board, all ambulance districts are seeing about a 10% increase. And that was, of course, before this last claim. We were hoping to not have any more claims, but those deer decided otherwise. So, I mean, that's kind of the same thing. Last time we bid that out, I think the only other company, there was 2 or 3, but last year it was just MoPerm and Allied Risk. Eric, do you remember, didn't he say there was 3 companies right now that were writing ambulance districts?
That sounds right, yeah.
So they're still working on some things to get us the hard numbers, but that's where it's sitting right now.
where we're gonna be with that in our next meeting, Jamie, you think?
I don't know. I mean, I know they're working on it, but we also just submitted a new claim as well.
Yeah, just for the newest member to the board, the newest members of the board, this becomes crunch time and things start happening pretty quick with our health and everything, because we don't get it till very late in the year. So.
Yeah.
It's a struggle.
So do we have time to see how this turns out for?
I mean, we have a little bit more time with the property and casualty just because it doesn't take as long, but not much. I mean,
So if we want to bid it out, we probably need to as well now.
yes, yeah.
And there's three companies.
I think that's what he said. Don't quote me on that. 3 or 4 companies that will write ambulance districts.
Yeah, they should be able to turn that around pretty quick.
Well, I think we need to do the same. I think we need to bid it. You know, I make a motion to bid.
All in favor, say aye.
Aye.
All opposed, same sign. Annual elective benefits.
So for this one, currently we offer 2 different companies for elective benefits. We have Aflac and then we have Liberty National. And those have been in place since prior to me being hired. I was actually brought this gentleman in Allstate from an employee that works at another ambulance district. And a lot of those ambulance districts have been switching over to Allstate. I'm sure Aaron can talk to you about why, but it looks to me, just looking at the prices of the offerings, that Allstate is a lower price. Now, this isn't anything that PCAD pays for. This is totally employee paid benefits. So this just puts more money into the employees' checks. The only thing that it helps for us is that I don't have to deal with 2 vendors, 2 open enrollments, 2 bills every month. It's just would take it down to 1. And both of our vendors currently, they offer the same, basically the same benefits. I don't know if they pay the same or how much they cost. But they're basically the same: cancer plans, accident plans, short-term disability is the type of plans we're talking about. So with that, I'll let Aaron tell you a little bit more about that, if that's okay with the board.
Thank you, Jamie. Like Jamie mentioned, I work with a lot of ambulance districts, and one thing I've noticed is that people are not in the ambulance business for the money. You know, a lot of good people that are interested in saving lives, and unfortunately, quite a few of the plans I've taken over, we're seeing employees who are paying in excess of $500, $600, $700, $800 more a year than they should be for those type of benefits. And my goal, and what I have been doing for the last several years, I've been in the business about 11 years, is just to cut that cost in half, put that money back in the employee's paycheck, and provide them with at least equal coverage. But what we're finding now is that we're far more benefit for about half the rate of what the employees currently have. I provided detailed policy payouts, detailed brochures, along with built-in biweekly rates on the accident, cancer, critical illness, disability, and life insurance options. Not that every single district takes all 5 of those options, but we're noticing with districts over 30 employees that they want to have more options other than just maybe 3 levels of coverage. Speaking to the actual benefit versus what you have now, in my experience, I've taken over a few hundred Aflac and Liberty National cases. I do the Missouri Association of Counties plan as well. I work with multiple counties, mainly from probably southern Missouri or at least mid-Missouri down. We're working our way up right now. So these plans, as far as comparing them to Aflac and Liberty National, we're far more benefit than what Liberty National offers, and we're a lower rate. In reference to Aflac, we are about in equal coverage in a lot of areas, for most of the time less than half the rate. We're just looking at the facts and the benefits side by side along with the rates. We also offer through the Missouri County's plan, and this plan we have for the state of Missouri, we offer guarantee issue coverage, which means that if an employee's had any kind of health challenges and, they would normally be declined on maybe a critical illness or a cancer plan or disability, we would give them full guarantee issue coverage. They would have to answer no health questions whatsoever to get on the coverage. So I'm here tonight just to kind of go through any questions you may have and kind of, give you details and take some notes and find out where we can end up at.
And you guys should have those printouts for the rates for both Aflac and Allstate there. And then the Aflac pamphlets, I just printed out one copy of that, but everybody should have the rates for both. And we were going to try to talk to the union today, but since we didn't have that meeting, we haven't had a chance to run that past them as well, to see what they would like to do, since it is totally employee paid for. Not that they get to decide, the board gets to decide, but since it's their benefits and they pay for them, I'd like to kind of know what they think about it.
So this would be a decision they would make.
No, you guys, it's always the board's decision, but I would like to hear some feedback from them because, like I said, it's totally their benefits. They pay for them. It's their options. But the other thing that I asked Aaron about was, these people have been paying for Aflac or Liberty National, how that works if we move to Allstate, because I don't want them to be out. Because some of these plans have a waiting period sometimes, like a short-term disability that they have to wait. Can you talk a little bit about that, Aaron?
Absolutely. When we take over, first of all, we provide zero lapse in coverage and we honor any waiting periods already in place. We do a complete policy takeover. We send, it's very typical for insurance companies to communicate with each other at a carrier level. And so on the takeover, we would just get a copy of the bill, send that to Allstate. Allstate would communicate that with the other carriers. On the disability with Aflac, if an employee's already had the coverage in place, when we take over, they lose none of their waiting period. They don't have to start over again. We honor all of that.
But this was really, go ahead.
Why is the board making that decision for the employees that they're paying for, the employees paying for it themselves? I mean, what's their take has been coming out of their paychecks, I'm assuming.
Mm-hmm.
Okay. And then does the employee not have a choice in this, or?
Oh yeah, they're totally elective. So they can pick all of them, they can pick none of them, they can pick and choose what they'd like.
We haven't asked that question yet, or are we going to, or?
Well, we tried to, but the meeting got canceled today, so.
Right. Yes, there was a meeting today between Jamie and this gentleman and the union, and that failed to take place. And Jamie, are we required by statute or bylaw to endorse this and present this as what we? I don't know. The question around is why is the board involved in something we have no authority over as far as management of or payment thereof?
Well, it's benefits that PCAD offers to employees, so.
Gotcha. So that's probably including our bylaws that we, I would suspect that's what authority we have to review this comes through.
Yeah, I can't answer the legal portion of that, but.
It sounds like what the board does is pick the company and then the employee picks what they want, what they want. But you can't go to the employees with two different companies because I don't think.
But to the union, we're speaking of the union.
Yeah.
And that's, the union is the folks that would,
They pick as a group.
So they pick the company?
I mean,
No.
I mean, my view is as a single board of director, if the union came and said, this is the plan that we want our individuals to pay for, would you take it out of our paycheck? This one we want, and it's something that we believe in, then I'd say, yeah, I'd go with the union choice. That's what I would do personally.
If I may chime in, I've met with many boards, whether it be a very small district of 8 to 10 employees or, 40, 50 down here in like Taney County ambulance. And so typically the CFO or someone in that position does run the company and the idea past the board. And what most of them have been doing in switching is just simply putting the facts and numbers side by side, looking at the reputation of Allstate with the Missouri counties and the state of Missouri employees who've been handling their benefits for over a decade for the state of Missouri. Just kind of look at those different numbers and facts and just like I'll kind of piggyback on what you just said. And that is, if you offer the employees 3 different types of coverage year round, no one remembers what they have anymore. They're very confused. You're dealing with 3 different bills, 3 different deductions, and all the companies basically offer the same coverage. But there's going to be one that's going to offer the best coverage, the lowest rate, just based on how they do business. And one thing you'll notice about Allstate is that we don't have a hierarchy. And we do a lot of business, nationwide with state governments and with associations like the MAA. And so it allows us to have a much lower rate and a higher benefit because we're just running very lean. Does that make sense?
Guess it would make it easier for us. I mean, we have to take a look at plans.
So is the meeting rescheduled with the union and the attorney?
It will be. We just don't have a date yet. And they have all the information. They have the Affleck rates. They have all the information you have. So as soon as we get a chance to talk to them, we'll get some information from them. So it was just to bring you guys the information.
Okay. So you don't need any action tonight. We can wait until you get feedback from those folks.
Aaron, we're kind of at the mercy of everybody being sick right now, but
Sure.
when do you need to know?
I'm on your timing.
Okay.
I mean, if you're wanting to do a December enrollment for January 1st coverage, for instance, for example, we have through the month of November to work this out. I think that taking our time and doing it right is very important, and I'm on board with that. Whatever because you're dealing with it, and I work with a lot of unions, especially down here in Springfield with Conco companies and different trucking unions. And so I understand that you have some layers of decision makers and things involved. So got to respect that.
Well, thank you for your time. Appreciate it.
Absolutely. Let me know when we can get on board with the union, and I'll make time.
Okay. I'll let you know as soon as I know something. Thank you.
Nice to meet all of you.
Thank you.
Thank you
so much.
Move on to new business, resolution 2020-05, 2020 budget amendment.
Okay. So I think you guys got a revised resolution, and stapled to that is that kind of breakdown of how all that plays out to get to those numbers on your resolution. So if you look at the top of it, the budget started out when we approved the budget in December last year. It was $650,162 for capital expenses. Since then, all of these other items have been approved by the board to purchase, but we haven't increased our budget. So I believe that was about July. You guys approved some chairs for the Windsor base, and then the new engine for Unit 6 was earlier in the year as well. Then the remainder of these items are things that you guys have approved to pay out of that CARES Act funds we received. So the air scrubbers for the bases, UV lights, ventilators, defibrillators, air scrubbers, all of those items add up to $401,787.11 that we need to increase the budget by. And then that breaks down to the different categories. And I kind of tried to highlight them so you could see that the facility improvements are the green items. And then that kind of tan color is the ambulance replacement. And then the rest is EMS equipment. So at the bottom, you can see where I have those three different breakdowns of the ambulance replacement, facility improvements, EMS management, the original budget and how that broke down, what the amendment is, and then the revised budget amounts. And that's what's on your resolution. So we're going to increase ambulance replacement from 434,167 to 442,270.19 to include the engine replacement on unit 6. And then as far as facility, it'll increase from the 70,995 to 78,471 for the chairs and the air scrubbers for the bases. And then the remainder is the equipment. Any questions on any of that?
Are there any questions on the budget resolution amendment? I'll take a motion to approve the resolution.
So moved.
Do we have a second? If not, I'll take a motion to go into closed session pursuant to RSMo 610.021, sections 2 and 9.
So moved.
Second.
All in favor, and that'll be roll call.
Mr. Brown?
Yes.
Mr. Buckley?
I don't think she's there.
Oh, he's there, his video's not off. Hey, Doc? Pursue them. Mr. Fritz?
Yes.
Mr. Griffin?
Yes.
Mr. Meehan?
Yes.
And Mr. Green?
Yes.
Call closed session to order.